they may not be aware of at certain points in time. And so framing that issue for the public or for the general population to actually understand what you're trying to say is really important. And of course, this is captured in diverse, your role is diverse in nature. You act as a bridge between policymakers and the public, and you make whatever policymakers are saying, you make it tangible, you make it things that the public can actually digest and understand what is being said by policymakers. At the same time, we are bridging the gap from the public to the policymakers and making the policymakers actually understand that this is what the public feels about certain issues that you're addressing. You play a crucial role in raising awareness and educating the public, especially about disadvantage. You facilitate stakeholder engagement and amplify the voices, especially for civil society organizations, because they're the ones who are from time to time engaged in advocating for certain things or for certain principles to be put in place. And so how do they do this? They might as well go directly to these specific people, to the policymakers or people in leadership, but then it's not every time that they have this opportunity. And so the only other viable opportunity that they can use, of course, is through the media. And so the media also plays a crucial role in bridging that gap. And you're also holding these people to account. You're saying that today you said you wanted to put something in place, you wanted to build a road. But then tomorrow or 2 days later you say, I don't think we need a road yet, we just need to buy the vehicles. And so you hold these people to account and say, look, how do you buy vehicles when you don't have the road, for example? And so it's really key because you hold these people to account and say, look, in actual procedure, you're supposed to come up with the road first before getting to the vehicle, and so on and so on. So what is your play in SRH? And I think this is just again emphasizing, and you've been hearing this a lot ever since you started engaging. You are in different platforms. We acknowledge that yes, you raise awareness on the need for safe and accessible services across the public. Okay, we are saying that people need to enjoy life. People need to be in a space where they enjoy well-being. And how do they do this? Of course, if we have the relevant services in place. We're also saying you challenge the stigma and cultural norms that might be existing around issues. And so you engage, for example, the religious leaders, you engage the traditional leaders, and you engage the public. And you're able to understand that probably there's a certain consensus, but there's a breakpoint. Probably whatever the traditional leaders say is sort of breaking off to what the religious leaders say, even though they're trying to sort of speak in the same voice in a way. And so you come in play and you challenge any such biases or stigma that may be existing in that space. You inform the public about health impacts, and you also push for reforms through either debates or those engagements that you usually have. You're seeing investigative journalism coming in. And probably from time to time, for example, if you're speaking about post-abortion care, you from time to time look at what are the budgetary implications that are being given to this. And if you don't have a budget, why don't you have a budget that can make people actually live well and enjoy living life? Okay? And so you also do a lot of this, and by doing this, you push for reforms in that space. So what you're saying in a nutshell is that the media is essentially driving the policy agenda. Very key, because then you set the space of what people actually discuss. You give priority to what people discuss. We're saying that through your informed reporting and sustained advocacy, you can push for safer reproductive health services. I'm sure from time to time, during this week, somebody actually in the room stated that they were sitting in a vehicle, in a passenger vehicle, and they were sitting right next to someone. And that person started having specific complications. Probably she had taken a certain drug that was actually interfering with her pregnancy at that point. And it had an implication because they had to stop the car, the person had to step out of the car and all that. If you are able to push out informed and sustained advocacy, then we can actually see more better services being given. And people actually appreciate that services need to be put in place so that you don't have such cases coming out when people are in the cars, or when people are sitting in the office, or when people are having such engagements, that things are actually working and they're working well, and to the betterment of people who are actually doing. Also saying that you're key in educating the public and influencing policy makers. That at the end of the day, you take this huge issue that might not make sense to the public, and you break it down so that they understand what you're trying to say. And at the end of the day, you also engage the policy makers in placing the priority. So that was just an emphasis. And I felt it's really important for us to speak through that emphasis, because then it's key in just reminding us the role that we play from day to day, from time to time, whenever we come in the space of SRH. And whenever we're trying to report something around it, that there are certain roles we play around, we live out. Having said that, there was a presentation that my colleague, I'll do it on his behalf, Ken. And it's about using the evidence that we have from time to time to inform the discourse, to inform discussions around, for example, the public health bill or the SRH matters in the country. The African Population and Health Research Center is a research and policy engagement institution that from time to time churns out evidence based on the research that it conducts across the continent. So it means that at any given point in time, the center will be having some information that would really be viable, that would really inform how we look at health matters or population matters in the country. In this specific instance, we're talking about in Liberia. And so, in this presentation that Ken had prepared, of course, it was borrowing a lot from the abortion incident study that was conducted in 2021 in Liberia and Sierra Leone. Out of this, I'm sure again you're probably engaged with this report, probably in a different setting. But then we want to look, with these insights, how can we bring them back? How can we bring them into our work as the media in what we cover from time to time? And so, basically this presentation would have looked at the outline, the profile of SRH and abortion in Liberia. Just look at the landscape. How are we covering, how are we giving prominence to this issue? Is it an issue that needs prominence? Is it an issue that needs priority? In any case, in Liberia, probably that's a conversation we can have. We're also looking at framing abortion for policy making. And then the key findings and how it can be used in engagements and advocacy. So in general, that's a snapshot of what you're going to discuss in the next few minutes, or what you're going to be looking at in the next few minutes. So in terms of the profile, and of course the researcher in Ken would have given a much more expressive insight into this. I think we're looking at how many children do women have on average in Liberia, for example, and we're looking at the fertility rate. Okay? And it's general, you're seeing that in urban areas, differently, each woman is getting approximately 3 children. Than in rural areas, where women in the rural setting are actually getting 5, okay, it's 5.5 children per woman. So there's that demarcation between rural and urban. And in terms of we're looking at the fertility rates in those two segments. And all this information is coming from the DHS in Liberia. It's not something we're picking differently, it's from the DHS. And there's a whole graph there, the graph has come on the trends in fertility. And as you can see, from 1986 up to 2019, 2020, there have been some variations from time to time that are playing out there. And rural is always higher, okay, compared to urban. And you can see the fluctuations that are going around it. How does this speak to what you're trying to look at? At this point, as I say this, probably I have no full picture, but it's something we can discuss. But then at the end of the day, we're saying that probably the way we engage the rural, people who live in the rural areas, probably needs to be strategic compared to how we engage people that live in the urban settings. When you're speaking about this, when you're speaking about a couple of these things. when you're talking about fertility rates, of course, the other aspect that comes in is, and you've already spoken about the number of children that women are having in the rural and urban setups. Is it viable? Is it viable for probably somebody to have 5 or 10 children? It's a point of discussion. Okay, it's a point of discussion. But what does this mean? Are there options that you have in place? Are there options that people can actually consider to ensure that they pace themselves? That they pace themselves so that they are also growing economically, they are growing socially at the end of the day. That's again a different discussion. And they're looking here at the percentage of married women who use a modern method of contraception. Again, this is information that is coming directly from the DHS. And you see those kinds of percentages playing out there. The unmet need for contraception is something that really comes in focus when you're looking at this, because we're talking about people being able to structure their families. We're not saying that they have to or they do not have to. We're just saying that people need to be considerate in how they are living or how they are carrying out their lives, insofar as building themselves, growing economically, financially. There are all those ramifications that come in getting into the family. And so, is there an unmet need for one of the options, which in this case is contraception? And what I'm seeing here is that 24% of married women and 45% of sexually active and married women are currently using a modern method of contraception. Now, 41% of women using contraceptives discontinued within 12 months. Why do you think this is the case? Why would they discontinue?
Yeah.
Yes, yes.
So most time when women start to take the contraceptive, they come to encounter other problems. That sometimes the message is not regular, and because of that, and sometimes they don't just see their period normally. It leads to other infection. Because of that, they try to stop it.
Exactly. There are different things that play out, right? When you start to use contraceptions. And the question that Ken usually asks when he gets to this slide is, and he usually bets $10. Winnie, is that right? Winnie? Ken usually gets to this slide, and then he asks this question. Of all the countries that you know across the world, is there any that you've seen that is championing for contraception or family planning methods for men? No. Currently, to date, as we speak, it's being implemented.
No, very developed. Yes.
Not really, right?
Yeah.
It's not concrete. Maybe there are discussions about having a male contraception, but it's not concrete. What about women? For women?
It's huge.
It's everywhere, right? There's a huge push around having contraception, family planning methods for women. And it has a ramification, of course, in as much as we say that it allows for spacing or for limiting the number of children and the regional and county variations in all this. There are certain discussions that also need to be had. Okay? Like what she's just brought up, for example, when you asked. We're only seeing this happening for women. Why do women discontinue after 12 months? It's because something happens to their bodies. And so again, there are certain discussions that need to be had. And I feel that us as the media who actually paints this picture need to actually take these insights into cognizance whenever we publish. Because there are certain stories behind it. And we really need to have concerted discussions or open discussions, candid discussions about what contraception means. Okay. Now, what percentage of women aged 15 to 19 have begun childbearing? For some reason, I'm not understanding why it's not bringing out the graph, because the 30% is not saying anything. The 44% is not saying anything. The 39% at this point is not saying anything. I'll try to find out what's the steps in, because then that is also a crucial statistic. Again, this is from the DHS. This is from the DHS. So I'll skip that and go to after the analysis of whatever kinds of insights